I mentioned the caudate lobe. When you think of caudate, you think of something caudal, but yet that's not really what this means. Caudate in Latin means tail. So the caudate lobe is like the stubby tail of a dog. Here's a little puppy here. And it's actually one of the more cranial parts of the liver. Now we pay attention to the caudate lobe because the caudate lobe is functionally an autonomous segment. And it has often been said that it is spared in liver disease. It has its own blood supply. It takes blood supply from the right and the left portal veins. And you can prove this to yourself if you carefully scan. If you have a good patient, a thin patient, and you look around the portal veins, you can see small branches entering the caudate lobe. And you can also see venous drainage, separate venous drainage directly into the inferior vena cava. And supposedly that drainage here is what helps to protect the caudate from other diseases. Now, another thing you should know about the caudate is that it itself can look like a mass sometimes. We call that a pseudomass. Here's a section of the liver, and it looks like there's a mass in the caudate. So I would caution you, this is an artifact. If you ever think you see a mass in the caudate, ask yourself first, are you sure that that's not a pseudomass? What happens with the pseudomass, the ultrasound beam comes through the portal structures and becomes attenuated. So it partially drops out, giving it the appearance of a hypoechoic mass. If you move off of this porta and come in with the beam from different angles, you will see that this is not truly a mass. That's why it's a pseudomass. Also, the caudate lobe can become enlarged, especially with cirrhosis. We can actually measure that. This is described in the literature. And the caudate is enlarged when a certain ratio of the caudate to the right lobe is enlarged. So what we would do, we would take a transverse section of the liver. We would take the medial margin of the caudate and the lateral margin as the lateral margin of the portal vein. That we would measure as the width of the caudate lobe, and the rest of it is the width of the right lobe. Then we would take a ratio of C over R, or caudate over right lobe, and if the ratio is over 0.65, that becomes an enlarged caudate. If the ratio is over 0.73 or so, that's very specific for cirrhosis of the liver. But you have to have the whole transverse scan on one picture. It's easier to do on CT. So now that we've talked about the hepatic and the portal veins, this leads us into the basis of modern lobar and segmental anatomy. This is the basis of surgical procedures nowadays. This is the reason why surgeons can go in and remove a subsegment of the liver, let's say a metastasis in a subsegment, and not harm other parts of the liver. This is possible because of now our understanding of this lobar and segmental anatomy. Now, we've already told you that hepatic veins drain peripherally, so they are interlobar and intersegmental, therefore we use them as dividers. Portal veins feed the segments centrally, so they are intralobar, intrasegmental, and we use them to name the segments. So here we'll start with the hepatic veins as dividers. Here's a transverse section high in the liver, and we see the three hepatic veins coming together at the inferior vena cava. The middle hepatic vein divides the liver into right lobe and left lobe. The left hepatic vein divides the left lobe into medial and lateral segments. But this only occurs in the high parts, cranial parts of the liver. That's where the hepatic vein is. The right hepatic vein divides the right lobe into anterior and posterior sections. Okay, so now we have right and left lobes divided. Now the portal veins, they feed the segments, we name the segments, and they define the segments. Okay, so here we have a portal vein with bright walls. The main portal vein just came into the liver and immediately divided into a right portal vein, which is rather short because it suddenly splits into the anterior segment and the posterior segment. Okay, so this is the division of the right portal vein. So here is the right anterior segment, and here is the right posterior segment of the liver. And notice, here's our right hepatic vein, and here's our middle hepatic vein. This plane of separation, middle hepatic vein in line with the inferior vena cava, is our divider of the liver into right lobe and left lobe. And the right lobe is further subdivided into anterior and posterior segments. The left lobe has its own divisions. Now here, after the vein split, the main portal vein, the left portal vein has a longer course. It travels towards the left lobe and suddenly takes an abrupt anterior turn. This is the only part of the portal system that suddenly aims anteriorly. Okay, that's the umbilical segment of the left portal vein. And it sends off lateral branches and medial branches. So this would be the medial segment of the left lobe, and these are lateral segments of the left lobe. This is used as a divider. This is the only part of the portal